Planning for Retirement, the Basics. This presentation is designed for University of Michigan faculty and staff who are considering retirement. Today we'll provide an overview to get you started with retirement planning. Much more information is available on the University Human Resources website at hr.umich.edu under Retiring from U of M in the Benefits and Wellness menu. We also recommend that you reach out to TIAA or Fidelity Investments and your local Social Security office directly to help you plan for a successful retirement. What topics will be covered? Today we'll cover retirement eligibility, benefits in retirement, retiree privileges, phased retirement, Social Security and Medicare, and next steps. We won't cover financial planning for retirement. Instead, we recommend that you schedule a free appointment with TIAA or Fidelity to discuss your retirement portfolio, investment strategy, and what your income options will be when you retire. Retirement eligibility. Retirement means voluntarily terminating your employment at the university once you have met certain age and service requirements. Eligible University of Michigan retirees can continue certain benefits and maintain many perks and privileges. Your eligibility to retire is determined by a point system. The number of points you have is equal to your age plus your years of continuous eligible service. Service that counts towards retirement includes your continuous years employed in a status that was eligible for both the basic retirement plan and a U of M health plan. Service that does not count toward retirement includes time in a supplemental, adjunct, or Leo 1 title with less than 50% effort, or time as a house officer, research fellow, professional specialist, or graduate student. Temporary hourly employment also does not count toward retirement. There's more information about eligibility and years of service on the Human Resources website under Retirement Eligibility. In particular, if you had breaks in service or you worked part-time during your career here at U of M, you'll want to read more about how this may affect the amount of service you accrued and when you are eligible to retire. You can also get a quick idea of your estimated retirement eligibility date in Wolverine Access. Select Employee Self-Service under the Faculty and Staff tab, then Benefits, then Retirement Self-Service. One of the menu options is Estimated Retirement Eligibility Date. The program will display the earliest month and year during which you will be eligible to retire from the university with benefits. Benefits in retirement. Many but not all benefits continue for eligible university retirees. Benefits that continue in retirement include health and prescription drug coverage, your dental plan, vision plan, legal plan, and life insurance. Retirees participate in open enrollment just like active employees, so you can change your benefit elections once a year like you do now. One thing to note is that you cannot add a new dependent to any of your plans after you retire. During your last open enrollment period as an active employee, make sure the dependents on your plans are the ones you want to cover in retirement. If you plan to move out of Michigan after you retire, you'll want to be in a health plan that offers national or international coverage. Currently, only the PPO plan and the Comprehensive Major Medical, or CMM plans, offer coverage outside of Michigan. If you are enrolled in the basic level of university life insurance as an active employee, your coverage will convert to retiree coverage upon your retirement. However, the amount of coverage will decrease each year starting at age 56 for a maximum of $2,000 of coverage at age 66 and older. If you want to continue optional life insurance coverage as a retiree, you can't do that through the university, but you can contact MetLife directly to obtain a conversion. What benefits end in retirement? Certain benefits do not continue in retirement. These include the university's group and optional life insurance, dependent life insurance for your spouse, child, or other qualifying adult, the long-term disability plan, flexible spending accounts, retirement savings plans, and business travel accident insurance. If you retire on the first of the month, your active employee benefits end on the first of the month, and your retiree benefits start the same day. If you retire after the first of the month, your active employee benefits end on the first of the following month, when your retiree benefits begin. As a retiree, you'll pay a different portion of the cost of your health benefits than you did as an active employee. Your share is determined by your service date and your retirement date. You can view retiree healthcare rates on the Human Resources website. There's a flowchart to help you figure out what chart applies to you. There are also different levels of individual and family coverage in retirement based on whether you and any of your dependents are eligible for Medicare. On the rate charts, regular means someone who is not Medicare eligible. One important thing to know is that if you were hired on or after July 1st, 1988, and you retire before age 62, there is no university contribution to your retiree health benefits until you turn 62. You'll pay the full cost before age 62. Some retirees choose to waive health and dental coverage through the university if they have access to another plan through their spouse or another job. You can re-enroll in university coverage at age 62 as long as you maintain comparable coverage the whole time and contact the Shared Services Center to re-enroll within 30 days of turning 62. Comparable coverage means your health plan provides coverage for primary and preventative care, hospitalization, surgical services, emergency care services, mental health services, office visits, prescription drugs, and diagnostic tests, including X-rays and lab work. Comparable dental coverage must include basic coverage for routine exams and cleaning, X-rays, and emergency treatment to control pain. Retiree privileges. Retirees can continue to access many university amenities and services. Once you retire, you can trade in your employee ID card for a retiree ID card. You can also request a retiree parking permit for Blue Lots on the Ann Arbor campus after 3 p.m. Other privileges include Retirees Association, temporary employment opportunities, athletic tickets, access to rec sports facilities and university libraries, computing support, continued use of your umich.edu email address, and subscription to university publications. A complete list is available on our website. Phased retirement. Phased retirement is a great option for anyone who wants to gradually transition into retirement. Under phased retirement, you and your department agree to a plan in advance that lets you reduce your appointment over time. At the end of your phased retirement period, you will be fully retired. Phased retirement is not early retirement. You must already be eligible to retire to qualify for phased retirement. Your phased retirement plan must be approved by your department and the appropriate director or dean. Your plan must include an end date, your initial reduction in effort, and any additional reductions you plan to make, and whether you plan to combine phased retirement with time off. Once you start phased retirement, you cannot go back to 100% effort, although you can modify your original plan with department approval. There are two unique things about your benefits under phased retirement. The first is that you can maintain your active employee benefits throughout phased retirement even if you go below a 50% appointment. Ordinarily, you wouldn't be eligible for benefits at less than 50%. However, certain benefits that are based on your appointment fraction will be prorated, including life insurance, contributions to your basic retirement plan, and time off accrual. The university's contribution to your health benefits will be based on your salary before you started phased retirement. The second unique provision is that you can draw on your retirement accounts with TIAA during phased retirement, either by starting a lifetime annuity or using the interest payment retirement option. Note that once you start taking an annuity, it cannot be stopped. Whether you invest with TIAA or Fidelity, if you have an SRA or supplemental retirement account, you can access those contributions at age 59.5 during phased retirement. Similarly, if you have a 457B deferred compensation plan account, you can access those contributions at age 70.5 during phased retirement. One thing to note is that your health care costs in retirement will be based on the rates in effect when you fully retire, not when you started phased retirement. Social Security and Medicare. I'll talk a little bit about Social Security and Medicare, but we recommend that you contact these agencies directly with questions. Some additional information, including a recorded presentation by the Social Security Administration, is also available on the Human Resources website by searching Social Security. The Social Security Administration's website is a great resource. We encourage faculty and staff who are considering retirement to become familiar with what this site offers. Please always check to make sure you are visiting an SSA website with .gov in the address. On their website, you can look up your retirement age, estimate your life expectancy, estimate your Social Security benefits, test out scenarios with different retirement ages or future earnings amounts, find out what happens if you work after you retire or are already a Medicare beneficiary, and learn how certain types of earnings and pensions can affect your benefits. Here is a brief video that may help answer some of your basic questions about Social Security and Medicare.
Hi, I'm Barbara from the Social Security Administration, here today to talk to you about the Retirement Toolkit. The Toolkit is a collaboration of the Social Security Administration, the Centers for Medicare and Medicaid Services, and the Department of Labor. We created the Retirement Toolkit because we want you to have the information you need to make the best decisions about your retirement. You will need to make a number of important decisions as you approach retirement. Decisions that concern your Social Security benefits, your Medicare benefits, and your retirement savings accounts, such as 401k plans. Some of these decisions are especially important depending on your age. This is particularly true with Medicare. If you do not make a decision about Medicare at the right age, you may pay a higher monthly premium for your Medicare benefits. The Retirement Toolkit will help you understand which decisions you need to make and at what age. The toolkit contains a brief description of your Social Security benefits, your Medicare benefits, and the personal retirement savings accounts you may have through your employer. It also contains a list of publications and interactive tools to help you plan for retirement. And I think its most important feature is a timeline that indicates at what ages you need to make decisions about which benefits. Because knowing when to make certain decisions is so important, I am going to focus on the ages at which decisions need to be made about Social Security and Medicare benefits. The timeline shows that age 62 is the earliest age you can claim Social Security benefits. It also shows that if you claim benefits at 62, your monthly benefits will be reduced. In addition, if you continue to work and earn above a certain amount, your monthly benefits will be reduced even further. However, once you reach your full retirement age, your monthly benefits will be increased permanently to account for any months that benefits were reduced because of your earnings from work. The timeline makes clear that the full retirement age is either 66 or 67, depending upon your birth year. If you wait to claim benefits until your full retirement age, you will receive your full benefits and will not be subject to an earnings limit if you continue to work. In addition, if you delay claiming Social Security benefits until between ages 66 and 70, your monthly benefits will increase for every month that you delay claiming. This means that for every year that you delay claiming, your monthly benefits will increase by 8%. These increases in your monthly benefits are called delayed retirement credits. It is also important to know when to claim Medicare benefits. Age 65 is the important age. Medicare Part A, which most workers have, covers hospital insurance and has no premium if you paid Medicare taxes while working. Parts B and D, however, are subject to premiums and penalties. Medicare Part B covers medical insurance, such as doctor services, outpatient care, and home health care. You will be charged a monthly premium for Part B based on your income level. If you are already receiving Social Security benefits when you turn age 65, you are automatically enrolled in Medicare Part B unless you decline it. If you are not receiving Social Security benefits, you need to enroll during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. If you have group health insurance through your employer, you are able to postpone claiming Medicare until you retire or your coverage ends, whichever comes first. But the decision on when to claim Medicare will also depend on how your insurance works with Medicare. If you do not sign up for Part B when you are first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. Medicare Part D is the component of Medicare that covers prescription drug costs. You can sign up for Part D when you first become eligible for Medicare at age 65, or between October 15th and December 7th each year, or during special enrollment periods. Additionally, you will need to select a drug plan, and most of these plans charge a monthly premium. If you do not sign up when first eligible for Medicare, you may pay a penalty that will increase your premiums for as long as you receive Part D. The only way to avoid the penalty is to show proof that you have drug coverage that is at least as good as Medicare's, which is the case for most employer-provided health care plans. I hope you have found this brief overview of the Retirement Toolkit helpful. You can find the toolkit on our website at www.socialsecurity.gov/retire. I encourage you to take a look at the toolkit, the information it provides, and the publications it lists. Most importantly, think about the best retirement decisions for you.
Once you are 65 and retired, Medicare will become your primary insurance. Your health plan will provide secondary or supplemental coverage. Once you are 65 and retired, Medicare will become your primary insurance. Your health plan will provide secondary or supplementary coverage. This means that all services must go through Medicare first. One very important thing to know is that your health plan will be changed to supplementary coverage once you are 65 and retired. This means that it will only cover things that Medicare won't cover, whether or not you have already enrolled in Medicare. So it's very important to make sure that you enroll in Medicare Parts A and B in a timely fashion to avoid claims problems. We don't recommend enrolling in Medicare Part D prescription drug coverage. Your prescription drug plan provides the same level of coverage automatically with any health plan. Medicare enrollment. Here are some basic guidelines about when to enroll in Medicare. This information is provided as a general overview. Please contact Medicare or the Shared Services Center if you have questions about your individual situation. Medicare Part A is free, so some people choose to sign up for it when they turn 65, even though they are still working. Then they sign up for Part B, which has a monthly cost when they retire. You can also choose to wait until you retire to sign up for Part A and B together. If you retire before age 65, we recommend that you apply for Medicare 3 months before your 65th birthday. If you are still working when you turn 65, you can wait to apply for Medicare until you retire. We recommend that you do so no later than 30 days after your retirement date. If you cover a dependent spouse on your health plan, they should also apply if they are 65 or older when you retire. If your spouse is under 65 when you retire, they should apply 3 months before their 65th birthday. If you cover an other qualified adult on your health plan, the rules are a little different. Your other qualified adult must apply 3 months before their 65th birthday or whenever they first become eligible, no matter how old you are or if you are still working. Another reason to make sure you enroll in Medicare at the right time is to avoid penalties that could increase your Medicare costs in the future. Medicare allows you 2 periods to enroll without penalty. Your initial enrollment period is when you should enroll if you retire before age 65. Your special enrollment period is when you should enroll if you retire after you turn 65. We'll give you a letter to provide to the Social Security Administration to show that you were working after age 65 and thus qualify for the special enrollment period. If you forget or delay your enrollment past these 2 windows, you may have to pay a 10% penalty for every year that you could have been enrolled but weren't. And remember, your health plan will be adjusted once you are 65 and retired so that it won't cover anything Medicare would have paid for, so you want to make sure you sign up for Medicare in a timely fashion. Medicare does not work outside of the United States, so you won't be able to use it if you plan to move abroad after retirement. However, if you return to the U.S. at a later time and enroll in Medicare, you'll have to pay the 10% penalty for the years you weren't enrolled. If you have questions about Medicare, including about becoming eligible before age 65 due to a disability, you can find enrollment deadlines and frequently asked questions on the Human Resources website. We also recommend that you visit Medicare.gov or contact Medicare or the Social Security Administration directly with any questions you may have. Next steps. If you're still a few years out from retirement, there are a number of things you can do now to set yourself up to retire successfully. Retiring within 2 to 5 years. First, if you can, increase the amount you put away for retirement. You can sign up for a 403(b) supplemental retirement account at any time during the year. If you've maxed out your supplemental retirement account, you can also save more with the 457(b) deferred compensation plan. The annual limits of how much the IRS will allow you to contribute to these plans increases by $6,000 at age 50. Some faculty and staff choose to reduce their life insurance and long-term disability coverage as they approach retirement and put the savings from those premiums into a supplemental retirement account instead. Second, we encourage you to schedule a free consultation with TIAA or Fidelity to review your investment portfolio and start talking about your retirement options. You can meet on campus, by phone, or at local TIAA or Fidelity offices. There are also a wide variety of retirement planning tools and calculators on their websites. Lastly, you can get started on applying for Social Security and Medicare, depending on your age. Retiring within 12 months. If you plan to retire within the year, we encourage you to review the retirement checklist on the Human Resources website. Keep in mind that you should use your final open enrollment period as an active employee to set up the benefits you want and the dependents you want to cover in retirement, since you won't be able to change these until the next open enrollment period. Once you're within 3 months of retirement, you'll need to provide formal written notice to your department so that they can enter your retirement date into the HR data system. Once this date has been entered and you're within 60 days of retirement, you can request your retirement checkout kit from the Shared Services Center. This packet provides a personalized overview of your retirement benefits, as well as forms and information about your retiree ID, parking permit, Medicare Part B, and more. We recommend that you pay for your first month of retiree benefits by a check a week or two before you retire. If you turn in this payment to payroll along with the form to begin automatic checking or savings account deductions for your benefit payments, it will simplify the paperwork you have to do later on. If you don't set up automatic payments, you'll receive a monthly billing statement. Lastly, please make sure that you keep your address up to date with the university. For additional information on all these topics and more, please visit the University Human Resources website under Retiring from U of M in the Benefits and Wellness menu. If you have specific questions, please contact the Shared Services Center at 734-615-2000. Thank you and good luck.